So I am Dr. Whitney Ragland Bignall. I am a pediatric psychologist. I work in a primary care office, which is amazing to see patients 0 to 22. And I get the privilege of being the associate clinical director of the Kids Mental Health Foundation. So the Kids Mental Health Foundation was founded by Nationwide Children. So we are on a mission to give free, which I think is the key, expert created resources to every community. And we want to promote and provide understanding of mental health. I think it's important that we know that, we have a mental health crisis going on, but we can't treat our way out of it. And so our goal is to work upstream to provide resources so that in every child's upbringing, we're talking about mental wellness. Well, there's lots of things to really help prepare your kids for back to school. I think we got to think about one, talking to them, getting them set for it. We got to start early and talk about what you, as the parent caregiver's expectations are, but also what their expectations are for the school year. Talk about what are the things you think would help it to go well, what things you need to put in place, because we know having a routine and a schedule is really good for mental health. I talk to everyone about sleep because typically during the summer, we are a little bit more lax, but we want to get our sleep schedules back closer to what we're going to be doing for school sooner than later. We also want to get their minds prepared for back to school. So talking about, maybe it's a new school building, a teacher. So what is going to come with those things? How can they prepare themselves? Maybe it's visiting the school, going to the website, things like that. And then it's also thinking about their emotions, their feelings, and allowing them the space to communicate what those feelings are. And because some kids are nervous, some are excited, some are absolutely not excited and are dreading it. And so thinking about what their feelings are and talking about them can be really helpful. I also think it's important to think about how to partner with your child's school. We know that connecting and school belonging is so important for kids' mental health. And so having an active role in knowing who's at the school, the programmings and different events can be really, really helpful as well. And so we want to make sure that parents are doing those things with their kids. So the common issues that we see, mental health issues we see with our kids today, anxiety is a big one. And let's just be clear, we all have some anxiety. It is common, but we do know that unfortunately, when anxiety becomes something that is constant and getting in the way of our daily functioning, that can be a big problem, especially for school. And so there might be kids who are fearful of talking to other people or trying new things. They may be worrying a lot about different things. So we want to make sure we're thinking about anxiety when we're thinking about our kids. We know some kids are struggling with those externalizing behaviors, what I call those behaviors that are maybe getting them in trouble more, acting out, difficulty following directions or paying attention. And sometimes it's just difficulty just controlling emotion, right? And so thinking about how can we teach our kids how to regulate when they feel overwhelmed or stuck or frustrated can be really challenging for them too. And we also know that in general, sadness and isolation is something we've been seeing more and more of. And so, even in younger ages. And so, I think it's important for us to be looking for those things in our kids because sadness is not a disorder per se. We all feel sad. But if it's prolonged, it can lead to things such as depression. And so, we want to make sure that we are mindful and looking for those warning signs. So some of the common warning signs would be, I think, of isolating. So staying to themselves, being different than they usually are. Should start a little, thinking for parents that maybe something's different. Now, I know that we talk about, teens and as kids get older, they stay in their room more. That's true, but they shouldn't want to be in their room all the time. And they should still want to be connecting with friends. So if you notice that they're no longer interested in the things they used to be or connecting, that usually is a big sign. Kids often are irritable. And I talk about irritability a lot because You can have lots of different things and look irritable. You can be sad, you can be nervous, you can be angry, like, but irritable is usually a big sign that maybe something's happening that we need to look further into. The other thing that I also talk about a little bit is just some avoiding. So if we're avoiding people doing things, we want to really make sure we're checking in on that. And then if we see a decline in performance, so all of a sudden their grades are dropping or their ability just to do normal household chores or things, you're just noticing that the quality isn't as it used to be, that also may be a sign that they're struggling. So those are some of the key ones. And I think when you start to see these things, now I tell parents all the time, you might have a kid and they're sad one day, and that should say, okay, they're sad today. But if you start to see a week or two of this happening or a pattern persisting, or multiple things happening together, that should make you think, we probably should talk to someone. So I encourage you to talk to your child's pediatrician or medical provider, talk to the personnel at school that's assigned to talk, like school counselors that they have at the school and teachers, just to see, are they seeing the same things? And I think that's important, but also talking with your child. I think that's so important. And I know that I hear all the time from parents like, I don't know how to talk about that. We do have resources at the Kids Mental Health Foundation for some of those topics about talking about mental health, but where to go as well. Oh yeah. So we love having resources for every important adult in a kid's life. We know that they're in so many settings, so we want to make sure every adult has the resources. So if you are to go on our website as a parent or caregiver, we have resources on topics that we think every kid could benefit from. So we have topics specifically about how to just be mentally well, right? We will all want our kids to be thriving. So things such as routine and structure and how to cultivate happiness and kindness. But then we also have topics that I think are important, just like sleep and physical activity. And then kids are going back to school. So we have lots of resources on how to get ready to go back to school, how to partner with your child's school. Maybe if they're having some learning concern, learning the different accommodations that are there, but also resources if maybe school's not going so well. We have resources for that. We also have lots of resources on anxiety and other challenges we know kids are facing. We have pieces on that. And one of the things I love about the Kids Mental Health Foundation is we don't want to just give you information. We do have lots of it, but we also want to give you tools to do it. So we have lots of downloads that parents and teachers can download to work with kids on these topics. And I talked a little bit previously about talking to your kids. Having conversations is so important, not for just parents, but teachers, coaches. And we have lots of conversation starters about things such as back to school and talking about mental health, but things that might be a little bit more challenging, like bullying. So we really want you to know that if there's a common challenge that you think a kid may face, we probably have a resource there for parents to think about. And we would love for you to come and check out those resources on our website.